So I'm going to hand it over to you, Cathy, if you want to start. And once again, just thank you to both for being here.
Sure. I see some familiar faces on the call today. Jerry Current presented at our APF a couple of years ago, I think, if I'm not
Mhm.
mistaken. Am I right?
Yes, yes, Catherine, good to see you.
Good to see you too.
Good.
Yeah. So I'll jump right in. I'm going to talk a little bit about the International Alliance itself, and Jess is going to talk about the survey data that was referred to. And before I talk about the Alliance, I just want to introduce myself a little bit. I've been the CEO of the International Alliance for the last 5.5 years, and I also have a personal connection to ALS. My mother had bulbar onset ALS, was diagnosed in 2000 and lived with ALS until 2005. Um, I got involved in the community right after my mother passed and was on the board of directors of ALS Ontario and ALS Canada for 8 years until my term came to an end in 2013. But I've always worked in the association world. I've worked for a number of different associations, most recently before the alliance with the Canadian Bar Association. So it was fantastic for me in 2018 when the opportunity arose to marry my personal and professional passions with the ALS world and the association world. And that's my personal background, and I want to walk you through some background of the International Alliance. Our vision is a world free of ALS, and there's actually some subtext that often comes after a world free of ALS, which is many of our organizational members usually say, until there's a cure, there's care. And so the care component is very big for us until we get to our vision of a world free of ALS. So the next slide that Jess is going to flip to is our purpose, and we've changed the word associations to a different color here, to Alliance Teal, because we often describe ourselves as an association of associations. Everything that we do is informed by people living with ALS and their community or their caregivers. We do use the short form PALS and CALS. PALS stands for people living with ALS, and CALS is interchangeable with caregiver of someone living with ALS or community of someone living with ALS. So you might see that throughout the presentation. So our value proposition is that we act as a global gateway. Our biggest strength, I would say, as an alliance is that we're a global collaborator. So we encourage global collaboration, whether it's on education or research or care communities, better practice, and so on. So we very much see ourselves as that global gateway to collaboration internationally. And our main focus is our community. We have we're a community of communities, and we build the capability of our members through our internal capacity at the Alliance. So this is the area that we cover. We have a small membership with huge reach. So we only have about 65 members, but because they're organizations, they have quite broad reach. So you can see that the map is colored in where we have member organizations. But both Jess and I like to refer to the fact that even where there isn't something colored in, we still support the ALS MND community in those spaces, in those white spaces that we have, or gray spaces. So for example, with the biggest blank space on the map is in the continent of Africa. We're very aware of that. We try and include underrepresented communities in everything that we do at the Alliance, so that we just don't believe that we'll fully understand ALS until we understand the whole world. And so one of the initiatives that we're working on right now, for example, is there are recognized networks at the regional level in Europe and North America and in Asia Pacific. I'm sure you're familiar with the NEALS network and PACTALS and NCALS. And so the Alliance is supporting two new networks that are emerging right now. Jess is actually the individual that supports them. Through Secretariat, we have the ALS Africa Network, which is a number of neurologists in African countries. And she also supports the ELATAM network, which is the Latin American, ALS neurologists across, again, quite a few countries. So those are two emerging networks that we support at the Alliance. So even though there might not be member organizations in certain areas, through other networks, we support the whole ALS MND community. And so what is it that the Alliance does? We have kind of three main focuses that we work on, which are advocacy, education, and research. And within each of those, we have some very specific products and services that we offer as an association or as an alliance. Primarily, if you've heard of the Alliance before, it's because of the meetings that we have in December. There is, of course, a big research symposium that's run every December. It's actually run by the Motor Neuron Disease Association of England, Wales, and Northern Ireland. It's not, it's done in cooperation with the Alliance, but we don't run it. MNDA does. And attached to the research symposium are two meetings, and Jess is going to talk about the Allied Professionals Forum a little more, but there's two meetings, an Alliance meeting and an Allied Professionals Forum. And primarily that's what the Alliance was known for its first 30 years or so. In 2019, our board of directors made a strategic decision to spread our education out over the year and to begin to offer programs and services outside of the physical conference. And it was because of sustainability, the fact that many of our member organizations can't afford to travel. I'm sure you have the same thing in terms of your conference offerings, where you want to be mindful of the fact that not everyone can physically make it to one particular location. So, as I said, our board of directors made that decision in 2019. And honestly, it was the best decision because we decided to start offering webinars and roundtables, and our first roundtable was planned for April of 2020. And so we were totally prepared when the whole world shut down in March of 2020 to begin to offer these educational offerings virtually around the globe. And I truly believe that we felt closer during 2020 and 2021 than we did when we were meeting in person, because we had so many fantastic ways to collaborate virtually that we had already planned out. So anyway, that's our education offerings. And as I said, Jess is going to touch on the Allied Professionals Forum a little bit more at the end. And then in terms of advocacy, we work a lot with the WHO and the World Rehabilitation Alliance. That's relatively new in the last couple of years. And we have hired a research director who, as I said, we want to really enable global collaboration. So we're not a research funder. We don't give out research grants. But of course, many of our member organizations do. So what we've done is we've brought together all our research directors from around the world, and we provide, briefing notes and information to our members that don't have a research director. And we're beginning to, in the last year, by bringing our research directors together, we're beginning to make a landscape map of where there's opportunity gaps for research globally and internationally. And then the last piece I want to touch on this slide is the first two bullets, the fundamental rights and the fundamental rights survey. I don't have a screenshot of what our fundamental rights are, but this is something that's been around since the 90s, long before my time with the Alliance, and they're core and essential to everything we do. So the fundamental rights is a document of what are the fundamental rights of someone who's living with ALS MND. So they're like a subsection of human rights, but specific to ALS, MND. And so the fundamental rights, there are 11 of them, and I can't necessarily quote them all off the top of my head, but just to give you some examples, every person living with ALS, MND has the right to access the highest quality treatment. They have the right to access the highest quality care. They have the right to access genetic counseling and testing. They have the right to not be discriminated against because they have ALS, MND. They have the right to be remunerated or paid either by their government or by private insurance systems so that they can maintain their standard of living. They have the right to the highest quality of life. And I think those rights are very much where palliative care fits in terms of giving people the tools they need to be able to live with ALS in the best way possible once they've been diagnosed. So those fundamental rights, I think, are so important to everything we do. And so in 2021, again, out of that decision of our board of directors to spread our products and services out over time and not just be focused on the conference, we decided to do a survey. We know that the fundamental rights are aspirational and that obviously there's people around the world who don't have access to the highest quality care or the highest quality of life when they're living with ALS, MND. But we wanted to survey the landscape and see how the rights are being respected around the world. And so we did the survey in 2021. Jess was one of the primary authors of the survey. And honestly, we were blown away by the results. We, of course, had surmised ahead of time that there would be, vast differences between the global north and the global south, which was proven to be true. And there were also some very positive data points that came out of the survey in terms of, I jokingly said to someone once, if I was diagnosed with ALS myself, I would want to move to the Netherlands because they have such phenomenal multidisciplinary care. And so there were some very positive data points that came out of the survey as well. And so the survey was so data rich that we decided to do it again in 2023. And we expanded the questions we were asking. Just so you know, Jess is going to show you some of the data from the survey that pertains specifically to palliative care. We have so much data. So if there's anything that you might be curious about within the fundamental rights that we don't touch on today, feel free to reach out to us afterwards and we'll get you the information that you need from the survey. But when we did the survey in 2021, we had about 1,000 respondents. We only ask people living with ALS and their caregivers to answer their survey. We don't hear from health professionals or other individuals in the community. And when we redid the survey in 2023, we doubled the number of people that we received answers from. I believe we received answers from 52 countries in 16 languages. I can't remember what slides we have, Jess, but I don't think that's in there. We were quite confident in the data that we're really hearing from the community. We're really lucky because our member organizations, of course, work in multiple languages. And so they were able to translate the survey for us so that people were taking the survey in the language of their choice. And so one of the things as Jess is going through the survey data that I want you to focus on is we had a number of lenses that we used to analyze the data. So we were able to break it down on a per country basis. But also we used specific lenses around comparing the global north to the global south, urban to rural, language, whether the person answered the survey in English or answered in another language. And we also were able to compare the 2021 to the 2023 results. So without further ado, let's look at the data.
Thank you, Cathy. I just had like the dreaded message of your internet is unstable on my screen. So if I do freeze or you freeze on me, just give me like 45 seconds to flip to my mobile phone, but I'll be back. But just a warning that I might freeze on all of you. So yeah, so I'm Jessica Mabe. I'm program coordinator for the International Alliance. And just for those of you who don't know me, I'm part of the community. My mom had ALS, a bulbar onset. She was diagnosed in 2014 and she passed away in 2018. A very similar story to Cathy's, just a little bit later, but I decided to stay in Colombia to be with my dad. He was her caregiver alongside. We both acted as caregivers. So we have lived ALS at one point and still are in some way. So with regards to the data, so Cathy has already given you more context about how the survey worked. The survey was geared towards people living with ALS or caregivers of people living with ALS. So we refer to people living with ALS with the acronym PALS. Some people like it, some don't, but that's what you will see on the screen, PALS, when we're referring to those diagnosed. And one of the questions that was asked was, they were drill down questions with respect to the questions that went to the fundamental right of having access to the best quality care possible. So within that, they got the option to select which of this list that you can see on screen. I just see the point, these are remarkably low. Yeah, that's where I'm getting to. Yes. So this was the list of the different services that they could select multiple options. And as you can see, unfortunately, palliative care was sort of on the bottom one, just above hospice care and family counseling, but with 13%. So it goes without saying it's extremely low. Top of the list, you had medication, physical exercise, mobility, breathing and ventilation. But even with those at the very top, the best percentage was 56% agreement at a global level. So that's still low as far as we're all concerned. But unfortunately, palliative care is down at 13%. So with regards to the data itself, just to give you a little bit more context, we had the first survey run in 2021. And we did a second version on 2023. On the 2023 version, we got a little bit more experience with the survey and we were able to analyze in a few more areas. So as Cathy mentioned, we were able to do analysis against Global North and Global South, whether it was answered in English or in another language, whether they selected whether they lived in an urban or in a rural area. And also we were able to identify the Asia Pacific. I'm not going to focus too much on the Asia Pacific because we still had very low responses in that region. So it's not a very accurate. Kara, I see your hand up.
I just had a quick question. Was the question, do you receive good support or excellent support or satisfactory support, or is it just any support?
Yeah, just if you have access to. So we didn't drill further on what level at that point.
Just before you move off that slide, can I say something about this, Jess?
Yeah.
Is that okay?
Of course.
Okay. So one of the things we looked for when we looked at all of the data is where were there differences that were remarkable. So on this slide where the green box is indicating the palliative care percentages, to me, the one that jumps out the most is English language versus non-English language. And that was something that we saw in many of the different rights, was that there was a disparity of if you received services or if you answered the survey in the English language, we assumed that you were comfortable in the English language and so on. So there's definitely a language barrier with all ALS MND services that are available.
And I am always in conversations like, well, I'm always like, what about the rest of the world? We can't assume they speak English or that they're fluent in English. And it's a constant area of conversation in our meetings about how we can break through that barrier. So also, looking at the figures, you can also see, yes, 13% low. But also you can see even from looking back from response from the 2021 to the 2023 service, it was just a 2% increase in people agreeing that they had access to palliative care. But again, pretty much overall extremely low. Then the other area about the survey that allow us to analyze and understand the landscape globally is what we refer to statistically significant countries. So the survey went out to everyone, and we had responses to, I think it was close to 60 countries by memory, but we had statistically significant countries, just this that you see on screen. We had Turkey, Brazil, Spain, the United States, Australia, Canada, Colombia, Japan, the Netherlands, Denmark, and Korea. And by statistically significant country in the survey, we meant that either for the caregivers or the people living with ALS questions, they had at least 30 responses. So that was enough for the analysis to be, for some analysis to be done on the data. So what you can see here, for example, now, when you see the figures with respect to the statistically significant countries, you can see that around the highest ones, you have the Netherlands, which Cathy mentioned already that she would move there if she had to. But then we had also Canada with 18%. Australia had the highest at 25%. Then we had the United States at 20, but still they only had 80 responses for such a big country. And then you can see at the lower end, you have 6% for Brazil, 9% taxes from Turkey, Japan 10%, and even with Korea, it was a 0%. Just reading. Okay, now on the next slide, this is the question we had for caregivers of people living with ALS. So similar question was asked whether they were receiving care in any of these areas. And with regards to palliative care, 34% agreed. So it almost, higher than people living with ALS, but still low. And you can see even with all the other areas that we listed, the highest one was with just 48%. So overall for caregivers, they felt that, support that they're getting is very low in all areas. Looking at the breakdown of the different analysis we did, for caregivers, we found that there was a slight increase, better than it was for people living with ALS, from 28% or 34%. I see, are any of these bereaved or past? It could be, so caregivers apply for both. We do not differentiate whether the caregiver is current or previous, as long as they were a caregiver of people living with ALS. Then you can see from Global North and Global South, very little different. English to non-English speakers, very little difference. Urban to rural, very little. So across the board, globally, caregivers do not feel they're supported in palliative care. And then looking at the statistically significant countries, it's interesting how the percentages vary. So you can see at the highest rate, you have Mexico with 56%. Then you've got Korea at 48%. And then you have, you can see Spain with 44%. So they are slightly higher than what people living with ALS selected with regards to support. But again, it's still low. We will want to see it a lot higher. This is how this was another way how the question was presented. So they would select the level of agreement around how they received support in those areas. So with regards to palliative care, you can see globally, 34% felt that they were receiving support, but at the other end of the scale, we had 52% saying that, no, they are not receiving support in palliative care. I don't know if I went back here. Hold on, So with regards to that question, with regards to the level of agreement, you can see with the statistically significant countries how the breakdown went, with Mexico at 56. So pretty much in line to the previous chart that I shared with you earlier. We also did an analysis plan in 2023 ahead of the questions, and there was series of hypotheses, and one of the hypotheses that we put forward was that caregivers globally receive limited palliative care, bereavement advice, and services. And our data supported the fact that this is true, where agree that there has been a slight increase, but it's still low at 34%. Now, before I wrap up, so just gonna do the shout out.
Can I just I'm gonna jump off.
Yeah.
So go back to your APF slide, but
Yeah.
just on the survey part, I answered the question in the chat about no, we don't know the answer to the question that was asked, but keep in mind that these questions were Jess referred to them as a drill down of the right to access to care. So what we did was we asked that question 3 different ways on purpose because we were worried about the global audience not using the same wording and language as in every place. So for example, we asked, do you have access to a neurologist, to a physical therapist and occupational therapist? So we named actual professions, and then we had a write-in field, and we don't have that data to share with you today, but it is something we can look up. What other professionals do you have access to? So some people said they had access to a palliative care doctor or a physiatrist, or I mean, there were many different things that were written in. So we don't have that data right here and now, but that is something we can look into a little more. The other way we asked it, so we asked about professionals, then we asked in the way that you just saw the data in terms of, do you receive support for medication, for physical therapy, and so on. So we asked more about the type of support rather than the professional. And then we asked them if they had access to a multidisciplinary clinic, just straight out. And then what we've done is we've matrixed those 3 against each other. So this wasn't designed to be a palliative care survey. We just happen to have some information in there. And so I'm going to leave you with a question that you can either answer to Jess or answer to us later, which is, when we do the 2025 survey, which we're working on right now in terms of design, is there some burning need for information that you have in the palliative care space that if we just slightly tweaked the way we asked a certain question, you would have an answer that would be important to you? So you don't need to answer that question now. It's more just in the future, knowing that we do this survey and it has broad global reach. Is there something that would be helpful for you to know? And sorry, Jess, I just wanted to say that before I jumped off. And thank you so much for having us on the call today. I really appreciate it.
Lynn, I see your hand up.
Then go right ahead and ask your question.
No.
No. Okay.
No. Okay. All right. So no, we didn't do any data on medical aid and dying. We had, we asked question about end of life, but again, it was at a very high level, but not specific to medical aid. We asked about advanced directives, if they were familiar with advanced directives, but again, we also we found the issue about how that gets interpreted into different languages and the cultural piece with regards to advanced directives in certain parts of the world. But we definitely is something we're looking into for the next survey. Hi, Kara.
Yeah, I guess my reason for asking among the bereaved care partners, past care partners, what percentage reported receiving palliative care or hospice, was just to sort of get a sense of if people have gotten a full course of care, if the illness has run all the way through to its end, what percentage of people receive palliative care or hospice services at some point. So that was sort of my thought. I don't know if there's enough bereaved caregivers to be able to do that analysis, but another way to look at it would be among people with advanced stage ALS. And I don't know if you have anything about their stage.
We didn't, and we're looking to see how we can fit it into the next survey. We didn't ask precisely that for people living with ALS. We did not ask in what stage they were at or the progression level. And for caregivers, we didn't identify either. whether they were past or current, unfortunately. But we are looking to see whether it's right to ask the question based on how the flow of the survey goes.
I think that might be interesting because certainly, you know, depending on your stage of the illness, you have not yet encountered various types of care, but still could.
Yeah. And I see the question about where the data can be accessed. So on our website, you do have a webinar where we actually go high level through the data. And at the moment, it is taking us 2 years to the point where now with the data we're looking to build. So we are in the process of putting posters and infographics and reports together that will be eventually available on our website. But you can start with the webinar. And also at the Allied Professional Forum, we will also have several posters focused on different areas from the survey itself too. Okay. And then
right now, I'm just finding it on your website. Great.
Yeah, so the webinar is at the beginning of this year, I think it is. So you'll find it on the 2024 archives at the top. And then with regards to the Allied Professionals Forum, so pleased to hear a few of you are already planning to be there. So looking forward to meeting you in person. So it's going to be held this year in Montreal on December 4th and December 5th. You can register through our website. There's still early bird pricing. It will be delivered in a hybrid format. So those of you that cannot travel to Montreal, there's the option of joining virtually. I also wanted to, you can see the program through the website, and we have a section in care. We have another section for caregivers. And I also wanted to highlight, because we are going to have 2 guest speakers doing an extended presentation. You can see it there on the caregiver section on Hope for the Best, Plan for the Rest. I'm not sure how familiar you are with them. They've actually published a book, and they're going to be there with their books too, called, I don't know if you can see it. So it's from Dr. Sammy Winemaker and Dr. Sien So, and their book is called Hope for the Best, Plan for the Rest. And they'll be doing an extended presentation around that, and their palliative care specialists. So just wanted to say that there's going to be topics that you might be of particular interest, but I do invite you, if it is possible for you to go, it would be great to have you there. And I think that is all, and I'm open to any questions. If not now, further down the line or by email, I am always available. Thank you.
Jerome, I think your question's really interesting about medical aid and dying. I just wonder if you have any ideas about how we could ask about that, or, you know, I don't know. It's something that we tried to get at as well on a survey we recently conducted here in the US, but it is a difficult thing to sort of ask about. And I just wonder if you have thoughts on that.
You're asking me? Yeah.
Yeah.
So I think it's such an important topic from the conversations I've had globally, and I just don't have the data, but we asked a lot about advance directives, right? And the question, and it always shook me about, I don't know about it. I don't know. I'm scared to talk about it with my family. I've thought about it, but I don't know how to implement it. I don't know who to go to discuss further. And then with our PALS and CALS Advisory Council, we have this conversation on a regular basis. And then you've got the cultural component as being a global organization. So how they view or how they handle dying, let's say in America, is very different to Malaysia, for example. So being a global survey, it's a little bit tricky. Like we have to always pose the questions as a global concept, but I would definitely be open to discussing with you and working with you to see how, in answer to Cathy's question that she's left with you, if this is something that you feel we could word in some way for a survey, we can definitely work together and see how we can put something forward and try and get some interesting data. I keep seeing Lynn's hand up. I'm not sure if there's a question there. And I'll just put my email in here. We asked about whether people have ever considered how they can control the timing and circumstances of their death. Yeah, we did a webinar. It's on our care series. It was done last year, which was focused on end of life. So it's a little it's not from this year, but be keen to see if you have a chance to watch it to get your feedback and your thoughts on whether we missed something or whether we should address this in another webinar, and we can put a webinar together for next year. And I think the educational piece is the missing part at a global level, where people don't know where to start, what is involved, or misconceptions about at what stage they can start planning or thinking about it. And the even from the caregiver's aspect of they probably don't want to address it with the patient. There's that protective bubble. So and I think that's a big challenge. I volunteer for the association here in Colombia, and as you know, Colombia is a very Catholic country. They're becoming more open with regards to euthanasia, but so many times we find that families are taking away the choice from people living with ALS because they just want to either protect them or not give them the information, where it really should not be the case. It should be, I always say, you know, as long as they're informed, you know, and they're in a position mentally to make a decision for themselves, it's always the patient's choice. And unfortunately, there are walls that sometimes make it difficult. Yeah. Hi, Cara.
A website under support for people living with ALS and caregivers. You have a description of a lot of different types of clinical care that can be helpful to people.
Mm-hmm.
I wonder if it would be helpful for some members of our group to build out a page about palliative care, or help you if you're interested in that. Because I know there's a page about mental health support, and I can't claim that I've gone through all of these pages yet, but if it would be helpful to add a page about palliative care and hospice, that's something we might be able to help with. I know.
So that's wonderful. And it's interesting you mentioned that. So we've got a project, it's a knowledge map project that we're working on at the moment. It's not, it doesn't cover, it's not just about the website, but it's about all different levels of learning and content that we want to understand where content is missing, whether website is the right approach or whether it should be a webinar or another thing. So I'm gonna connect you, if that's okay with you, with my colleague Julia Simon, who is leading the project, because I think it's definitely worth you having a conversation with her to understand what content we currently have on this knowledge map and what could be missing. If you're okay to do that, that would be wonderful.
Certainly. And maybe I'm bringing, not throw you under the bus, but maybe you could be on that email too, because I know you've been thinking a lot about different resources.
Yeah, it was just, yeah, thanks. I was just going to offer that in October, I'm building an interactive tool that's currently housing the current resources that exist through the organizations. And so the hope is that it's interactive, and then if it's useful, then we can, instead of building new websites, potentially just have this resource, which is like almost like a Google filter or something like that, to expand out to the existing resources. So if whoever's, it's on our INPCS website, but if you're available to join, that's October 7th from 3
Yeah,
to
I've got
4
it on my
p.m.
diary. I'm definitely joining.
Beautiful.
So, and exactly what you said.
Yeah, it's going to be a prototype, so it's not perfect, but we want to make sure, like, I think having as many people there to ensure that we have the right content would be ideal, and then we can make sure it's complete, you know, and it's not going to be complete. There will be gaps, but then that might also aid in your exploration to say there are these gaps. And I certainly will say, you know, I purposely chose not to just do a Google search and include any or every single website that exists out there. It's really the vetted ones from the organizations that are included. So,
and that makes
so
total
having,
sense.
yeah.
Yeah, and you took a yeah, like you, as I was thinking, and I was like, and that's what part of the knowledge map is. The Alliance is such a small, we're a small staff organization with a lot of volunteers and member associations, so we're not interested in reinventing the wheel and recreating content. That's not what we're about. We're about really, and that's the point of the knowledge map, is the, you know, what's already there that is good quality, credible information that can be part of this, and not keep reproducing and recreating the same things over and over and over again, which it pains me sometimes to see that happen.
I guess about the webinars, I appreciated your thought, Jessica, that maybe a webinar would be even more useful than a website too, or you know, would be another way to present material, and we'd be happy to contribute to that. I didn't know if most of your webinars are geared towards people and living with ALS and their care partners, or if they're geared towards clinicians, or both, or if you have different types of webinars. But I was also thinking it would probably be ideal if we could partner with someone providing palliative care or hospice care in other parts of the world. Since it's an international audience, we might be a bit US centric in our thinking.
Yeah.
It would be neat to present with people who are working in other parts of the world.
So we would probably do that exactly for that reason, to make sure that it wasn't so North America centric. So we would probably get you on a panel with someone else from, you know, another part of the world, and just carry on this presentation / discussion on different topics that we would identify ahead of time with regards to, we've got an hour, what do we want to cover, what's the message we want to pass across. And our webinars, we do have some that are members only, but the vast majority are open to the community, and that tends to be the it'll either be representatives from ALS associations, because they tend to just pass the information from the webinar to their own community. And you have from across the world people living with ALS, caregivers and clinicians, depending on how the publicity of the webinar cascades globally. So we tend to open them. They tend to be open to anyone and everyone who's interested in the topic.
Interesting. Awesome. Anything else they wanted to share?
So I did take action. So I will be in the October meeting, and okay, I think Cathy's also planning to be there. But I'll also do a connection, just so that you know Julia, and that Julia has your contact details to you, Amberine and Cara, and then from there, you know, as she gets to that point, like she knows that you're there and available, if that's okay with you, I'll just do that virtual connection. And at any stage, you know, if you think of anything else, and if you think, oh, I wonder if that survey picked up this data, just drop me a quick email, and I'll see if I can sort the data for you to get you the information you need.
Perfect. And we'd love to share, you know, an opportunity to present if there's a webinar to present on members of this group. So if other people who are here in this meeting have interest in that, just let us know, because I know there's a lot of expertise in this group.
And I hope to see you in Montreal.
Sounds good. Yeah, I put it in the chat early in the meeting, but in case anyone joined late and didn't see it, I hope you can all join us at the International Neuropalliative Care Society meeting. That's on September 21 and 22 in Grand Rapids, Michigan. But there's a pre-conference on Friday, September 20th. It's going to be focused on palliative care for ALS, and we're going to have a presentation from a number of different people about, you know, relevant research in this area, and then have both small and large group conversations about where do we want to go next in terms of advancing palliative care for ALS, broadly speaking, regarding clinical work, research, advocacy, education, et cetera. So if you're able to join in person or virtually, that would be wonderful. And we really look forward to that. Chance to be together. I'll put the link to the registration website one more time in case anyone, again, joined late and didn't see it. Thanks, everyone. And next month on this monthly call, Astrid Girls will be presenting, and I think it's going to be a case discussion. So I'm sure to be a rich learning opportunity. And we'll see you soon.